Hi students, this is your instructor. We are continuing on through Chapter 10, Substance Use Disorders, with Segment 5. In this segment we're going to be talking about the etiology of substance use disorders. In this figure here, we're looking at just a real basic flow chart for how drug or alcohol dependence or abuse evolves. The first step is usually that the individual has a positive attitude or somehow some sort of positive exposure to drugs. In other words, either within their peer group or within their family setting, they have observed the use of drugs, or they have been told that the use of drugs is somehow positive. That in turn leads to experimentation, which leads to regular use, to heavy use, and then on to dependence or the abuse of drugs or alcohol. When we look at the etiology of substance use disorders, and we take a developmental approach, in other words, we're looking at it from across the lifespan, there's basically two pathways to alcohol abuse. In the first group, what we see is that individuals begin drinking in early adolescence, and then that increases throughout high school, and as time goes on continues to increase until that individual has developed a substance use disorder. In the second group, they drink lesser amounts, but then turned and increased drinking in middle school and again in high school. Boys are more likely to be in the first group, while girls are in the second. What I want to point out about this model here is that it doesn't account for all cases. It's not effective at explaining how everyone develops a substance use disorder. And it's not some sort of inevitable progression through stages. One of the things that we know when we look at individuals that develop substance use disorders, and we look at it from a developmental lens, is generally speaking, most of them will start using drugs or alcohol in early adolescence. And then it becomes a sort of progression. So very similar to the first group that we talked about. But some individuals develop a substance use disorder, either with alcohol or drugs. It can happen later on in life, particularly with alcohol. So this is someone who may use, but they use to a lesser amount, or maybe they're just using recreationally, and then as they get older, life circumstances become difficult, maybe loss of job, divorce, death of a loved one, such as a parent or a child or a close friend, or maybe multiple events, and then that individual then turns to drugs or alcohol in order to cope. When we start to talk about rehab, we find it is always easier to rehab that second group than it is to rehab the first group. Do we see any genetic factors? We know that genes do play a role. We do see that relatives and children of problem drinkers have higher than expected rates of alcohol abuse or alcohol dependence. And we do see greater concordance of monozygotic twins than dizygotic twins. Now remember, when I'm talking about twins, I'm almost always talking about the Minnesota twin studies, where you've got your identical twins that share 100% of their genes but are raised in different environments. And so what that does is it allows us to control for genes. And we do know that if one twin develops alcohol abuse or alcohol dependence, that we see a greater likelihood that that monozygotic twin, that identical twin, will also develop alcohol abuse or dependence. So we know that there are some genetic factors, but we also know that there's some shared environmental risk factors for illicit drug abuse and dependence. But they appear to be non-specific. So we know that they're there. We're not really sure what they are. We're still trying to tease this apart with research. And one of the things we believe is that the ability to tolerate large quantities of alcohol, it is probably an inherited diathesis. In other words, it can set you up to become alcoholic. But those environmental factors are probably playing a role also in becoming alcoholic. So for example, Asians have lower rates of alcohol abuse, and that's because some of them have deficient enzymes. They are unable to process alcohol, so it makes them ill. Genes and smoking. We believe there's some sort of relationship there. People with SLC-AS, they're less likely to smoke. They are more likely to quit. And smokers who with a defect in CYP2A6 gene, they're less likely to become dependent, and it is easier for them to quit smoking. When we think about substance abuse disorders, or substance use disorders from a neurobiological factor, and when I talk about neurobiological, remember I'm talking about the ways that the brain is hardwired. This has become really one of the dominant frameworks that we use to help us to think through why an individual becomes addicted to drugs or alcohol. Nearly all drugs, including alcohol, stimulate the dopamine system in the brain, particularly the mesolimbic pathway. And what happens is that when that pathway gets stimulated, it produces rewarding feelings, pleasurable feelings. There is some evidence that people dependent on drugs or alcohol have a deficiency in the dopamine receptor, DRD2. But what's challenging here is we have to ask ourselves the question, is it vulnerability or is it the toxic effect? So is it this vulnerability in the dopamine system that's leading them to seek out drugs and alcohol, or rather is it the consumption of drugs and alcohol that has led to problems with the dopamine system? As I said earlier, one of the dominant or predominant models, developmental models, when we look at the trajectory of how alcohol abuse and dependence develops, we focus in on adolescence. We almost always see that abuse starts in early adolescence. And when we think through this neurobiological framework, we have to think about the adolescent mind, the adolescent brain, which is still developing, which is still changing. And if that brain is being exposed to large levels of drugs and alcohol, it's going to impact the development of that brain, and it's going to impact the hardwiring of that brain. We do know that people take drugs to avoid the bad feelings associated with withdrawal. We've talked about this already when it comes to opiate use. In other words, once they start to come off of the drugs and they start to feel those feelings of withdrawal, so physically they're not feeling very well. In addition to that, if they're using drugs or alcohol in order to not deal with psychologically bad feelings, it's going to increase the likelihood of relapse. Another theory is the incentive sensitization theory. It's very important here to be able to distinguish between wanting, which is a craving, versus liking, which is the pleasure. This leads us into thinking about it from individuals that use drugs and alcohol recreationally to those that use them because they are dependent. In the incentive sensitization theory, the dopamine system becomes sensitive to the drug and any cues that are associated with the drug. So things like needles, rolling papers, so on. And these cues induces and strengthens the wanting. So this is in part, it's a neurobiological model, but in part it is connected to learning. That the brain, when they're shown cues for a drug, for example, a cigarette or needle, it's going to activate that reward and pleasure areas of the brain. And that's going to cause them to seek out that drug, make them feel like they have a wanting or craving for that drug. So here's some of the different reward pathways in the brain that are affected by different drugs. Alcohol, opiates are one area, and things like amphetamines and cocaine, opiates in another area of the brain. When we think about the etiology of substance use disorders, do we consider any psychological factors? One of the things that we do look at is mood alteration. Does taking that substance affect that individual's mood? Does it affect them emotionally? We know that tension reduction may be due to quote-unquote alcohol myopia. So when an individual is drinking, what they focus in on is the reduced cognitive capacity, the immediate distractions, and that shifts their attention away from any of the tension-producing thoughts or the negative emotional thoughts that they might be happening. In fact, very, very similar for smoking. When I talk about smoking from a motivational perspective, one of the things we know about smokers is they're going through life. Maybe they're driving, or they're walking, or they're working. They have a negative emotional thought or a negative distraction that increases tension. They go to reach for the cigarette, and there's a lot of sort of small behaviors that go along with smoking. The cellophane, the getting the cigarette, the getting the lighter, taking the drag, all those things are very, very small behaviors that distract that individual. And when they finally take that drag, what they find is it has reduced that tension or reduced that negative affect or emotion that they've been having. Unfortunately, what happens is as time goes on, they develop tolerance and they need to smoke more in order to keep those negative thoughts or that negative affect from happening again. Now, alcohol and nicotine may increase tension when there's no distractions present. So this sort of phenomenon of crying in one's beer. So what happens here is that impacts people's expectancies. People who drink alcohol or people who smoke or people who use drugs to reduce stress and anxiety, if they expect that those tools, that those substances are going to help them to reduce anxiety, they're more likely to drink. They're more likely to use drugs. They're more likely to smoke. And then what happens is the drinking and the positive expectancies begin to influence each other. You drink, you have a reduction in tension, you expect in the future that drinking will continue to reduce your tension, and it ends up becoming a sort of a positive cyclical relationship. Are there any personality factors that predict the onset of substance-related disorders? We do know individuals that are negative, that have negative emotionality or negative affect. They are more likely to abuse drugs or alcohol. If an individual has high arousal, they're more likely to seek out drugs that are going to lead them to have high arousal. And they have very low constraint. In other words, they don't have any conservative views or cautious behaviors that will keep them from using drugs and alcohol. When we look at personality in kindergarten children, we find those that were high in anxiety and novelty seeking were more likely to get drunk, smoke, and use drugs in adolescence. I'm going to tell you about a super piece of research that was done by Miskel. It's called the Stanford Marshmallow Study. And what he did was he looked at children that were in preschool. They were 4 years old. And he gives them a marshmallow. And what he says to them is, I'm going to set this timer for 3 minutes. And if you can wait 3 minutes and not eat the marshmallow, when I come back, I will give you 2 more. And what he finds is some children eat the marshmallow straight away. They don't wait. And some can really hang in there and they wait the 3 minutes and they get the reward. And some struggle. And some struggle to wait and can do it, and some can do it easily, and some struggle and can't do it and end up eating the marshmallow. What he finds are those children that eat the marshmallow. In other words, they have low emotional regulation. They're unable to engage in what we call executive function. They're unable to understand that if I wait, I will get a bigger reward later. They want instant gratification now. Those children are more likely to struggle with substance use disorders later on in adulthood. Do we see any sociocultural factors in terms of substance use disorders? We know that alcohol is the most common abused substance worldwide. The highest consumptions are in France, Spain, and Italy. Consumption there is widely accepted. We do know that worldwide men consume more alcohol than women. We know it varies by country, but generally, when we take a global perspective, men do consume more alcohol than women do. And what we do know is that the more available drugs and alcohol are, the more likely you are to see an increase in usage. So usage is always higher when alcohol and drugs are easily available. A very interesting piece of research done among young people who'd been approached by drug dealers. Their drug use, if you are a young person, if you are an adolescent and you've been approached by a drug dealer, the likelihood that you will use is 35%, compared to those who are 7% who had never been approached, who had not been approached. So availability has a big impact on a person's using of drugs and alcohol. Family factors, we see higher rates of alcohol abuse in families where parents do use alcohol, where there's marital discord, psychiatric or legal problems, where there's a lack of emotional support. We see an increased use of cigarettes, marijuana, and alcohol, and also a lack of parental monitoring. That's also linked to higher drug usage. Other things we look at when we consider sociocultural factors also include social network. Do an individual's peers impact or influence that individual drinking or using drugs? And Buller's found evidence for both. So if an individual has peers who drink, that influences drinking behavior. So this is a social influence. But what also happens is that individuals then actively choose friends who drink or who have drinking patterns that are similar to their own. And that's social selection. So in other words, if an individual is motivated to drink and they have friends who don't, they will seek out friends who do drink. We also know that advertising media plays a role. Countries that have banned ads have a 16% less consumption than those that don't. We found this to really be true with cigarettes. You may take it for granted, those little warning boxes on the cigarettes, but they have had an impact on reducing people's smoking habits.